In this video, we'll explore the concept of a placebo, why it's important, and its role in clinical trials. Understanding placebos can help you better appreciate the research process and the benefits of participating in clinical studies. Let's dive in. A placebo is an inactive substance or treatment that has no therapeutic effect. In clinical trials, it is often used as a control to compare the effects of the actual treatment being tested. Placebos can take many forms, including sugar pills, saline injections, or even sham procedures that mimic the real treatment without any active ingredients. The primary purpose of a placebo is to provide a benchmark against which research can measure the effectiveness of a new treatment. By comparing the results of participants receiving the treatment to those receiving a placebo, researchers can determine if the treatment has a real effect beyond what could be attributed to the participants' expectations or psychological responses. In a clinical trial, participants may be divided into two groups, one that receives the active treatment and another that receives the placebo. This is often done in a randomized and double-blinded manner, meaning neither the participants nor the researchers know who is receiving the treatment. This setup helps ensure that the results are not influenced by bias or expectations. Placebos are particularly important in trials for subjective conditions such as pain or anxiety, where the perception of improvement can be strongly influenced by a belief in the treatment. By measuring the differences between the treatment and placebo groups, researchers can evaluate whether the active treatment provides a significant benefit. Placebos are essential in some clinical research for several reasons. Placebos allow researchers to isolate the effects of the treatment from other factors, such as the placebo effect. The placebo effect can lead to real changes in a participant's condition, simply because they believe they are receiving treatment. By including a placebo group, researchers can better understand the safety and side effects of the active treatment compared to an inactive alternative. The use of placebos enhances the scientific rigor of a study, making it easier to draw accurate conclusions about the effectiveness of new treatments. If you're involved in a clinical trial that uses placebo, please keep these points in mind. Before joining a study, you'll receive detailed information about the trial, including the possibility of receiving a placebo. Receiving a placebo means you will not receive the active treatment during the study, but this is essential for evaluating the new treatment's effectiveness. You can withdraw from the study at any time, regardless of whether you are in the treatment or placebo group. Placebos may play a critical role in clinical trials, helping researchers determine the true effectiveness of new treatments while ensuring the safety of participants. By understanding placebos, you're empowering yourself as a participant in clinical research. This is not medical advice. Talk to your doctor before making any medical decisions.